नमस्ते, मैं सर जीवेन शिल्पा ठाकुर, Faculty of Pharmaceutical Science, Jayati Vidyapeeth Women's University. Today's my topic is implantable drug delivery system. It is a part of novel drug delivery system in which we already studied about polymers. Firstly, what do you mean by implantable drug delivery system? These implantables are placed under the skin and designed to release drugs to the bloodstream without the repeat insertion of needles. Here, as we know, little insertion, that is, giving an injection, is the most havoc creative and difficult task as everyone is not comfortable with the same. The pain it causes, the stress it creates. So, novel drug delivery systems are being made to rectify that problem. Definition is a sterile drug delivery device. It is a sterile drug delivery device that is used for subcutaneous implantation, having the ability to deliver the drugs at a controlled rate over a prolonged period of time, comprising a rod-shaped polymeric inner matrix with an elongated body and two ends. Here, it is made into a rod shape. Inside, matrix will be present and it is a long body that will have two ends. Next, let us start with the ideal properties of the implantables. These implantables should be environmentally stable. It should be biocompatible as they are going to be placed inside the skin. It should be easy to sterilize as it will be placed in the body, so it has to be sterilized. It will be placed in the contact with the inner tissues. It should have a rate controlled release of the drug. These implantables should improve the patient compliance as by decreasing the frequency of drug administration over the entire period of treatment. It should be easy to manufacture and relatively inexpensive. The manufacturing of the novel drug delivery systems is said to be very costly as they are novel. So the manufacturing should be made in such a way that it is easy and so it is inexpensive. Next, next property is good mechanical strength. It should have a good mechanical strength as it is going to be used for a prolonged period of time. These implantables are made for 1 month. It can be for the treatment of 1 month, 3 months, 6 months, 1 year, 10 years. These many such implantables have been developed. It should be free from surgical procedures. The implantables should be trying to made which can be used without surgical procedures. Next, we will discuss about advantages. First advantage is convenience. Implantables permit the patients to receive medication outside the hospital with minimum medical surveillance, so it is convenient for everyone. Next is the compliance, as we talked about better patient compliance in the ID properties. Next is the improved drug delivery. The drug is delivered locally or systemic circulation with minimum interference by biological or metabolic barriers as it is placed inside the body, as it is placed in the contact, so it can easily deliver the blood in the systemic circulation. It will have no barriers. Next is potential for control release. These implantables follow zero order control release kinetics, so it can reduce the dosage frequency and samely increases the patient compliance. Next, let us talk about the potential for intermittent release. Extremely programmable pumps. These implantables are known as pumps. These extremely programmable pumps can facilitate intermittent release in response to many factors such as cardiac rhythm, metabolic needs, etc. These pumps can be made in such a way that they work according to the cardiac rhythm for the drug release pattern. As the cardiac rhythm goes lug, dug, lug, dug. So the drug release will be produced in the same pattern. Release and stop, release and stop. Similarly, it can also be produced in the metabolic needs, like whenever the body is insufficient of some metabolic rate, that at that time at that time uh, the drug will be released from the implant. So it can also depend on the increasing and decreasing of some metabolic needs in the body. Next is flexibility. It should be easily flexible as it is going to be placed inside the skin, inside the body. It should control delivery of hydrophilic and lipophilic drugs can be obtained by these. Next, let us talk about some disadvantages. Everything has an advantage and disadvantage both. First is invasive. Patient has to face either a major or minor surgical procedure. Yes, disadvantage is mainly that the patient has to undergo small minor surgical procedure to insert the implant. Next is termination. Non-biodegradable polymer implants terminated at the end by surgical method. We have to insert the implant, and we also need a minor surgery to remove the implant at the end of the treatment. It can be sorted out by using bio-erodible polymers so that this termination problem can be sorted out. Next is danger of device failure. If the device fails, again, surgical steps should be taken. If the device fails, we have again to carry out surgical steps to remove the device and to insert a new one. Limited to potent drugs. It is limited to potent drugs that are used in minute quantities, as the implant cannot be made a big one. It has to be small. Next, some adverse reactions. Sometimes if the product fails, the high concentration of drug can create an adverse drug reaction. That is a major disadvantage. Next, we'll talk about mechanisms of release. Uh, the implantables are classified into three classifications based on the mechanism: rate programmed drug delivery system, activated modulated drug delivery, and feedback regulated process. We will uh, talk about some. First is the polymer membrane permeation controlled drug delivery system. Here, as the name undergoes, it is kind of reservoir system. We had discussed this earlier in the polymers. Drug reservoir is encapsulated by a polymer layer. It is covered with the rate controlling polymer membrane, and it can be done by encapsulation, microencapsulation, molding, etc. methods. Polymeric matrix diffusion control drug delivery system. Here, the drug and the polymer is combined, bind together, is mixed, and then form the implant, in which it will be slowly released along with the polymer. Next is membrane matrix hybrid type drug delivery system. Here, it is in hybrid, means it hybrid of two, that is A and B types. It follows constant drug release kinetics, thus reduces the chance of dose dumping from the reservoir compartment. Here, as it is shown, in the middle one, inside membrane, it is drug plus polymer, that is matrix form structure. And after that, a polymer layer is also present on the outside. So both the methods are used, and it is a sandwich type implantable device. This is known as a sandwich type implantable device, as it creates a sandwich. Next is micro reservoir partition drug delivery system. Here, the drug reservoir is a suspension of drug crystals in an aqueous solution. Here we are talking about liquids. And it forms a homogeneous dispersion. Drug reservoir, it is a mixture of aqueous solution, drug crystals. Then the micro dispersion is obtained by the high energy dispersion technique. In this, different size and shape can be obtained with the help of extrusion methods and molding methods. Here, as we see, polymer and matrix, that is the drug reservoir, and then outer side we have a coating material to protect it. Next is osmotic pressure activated drug delivery system. Here, it works on the osmotic pressure. Osmotic pressure is the main source of energy which is used to activate and modulate the drug delivery. The drug reservoir is either a solution or a semi-solid state contained within a semi-permeable compartment with controlled water permeability. Here we can see the drug reservoir, which can be a solid or a suspension. It is released through a specially formed orifice, and it is a rate controlled process by the osmotic gradient. Here we can see this layers act as a osmotic agent which contains water entering through the semipermeable membrane. First, the water will enter through this containing semipermeable membrane. This in this layer, this water creates a pressure, and so as the pressure is created on the inner system, the drug that is inside is released outside through the orifice. And so the implantable works and drug release occurs. Uh, Next is Higuchi Leaper osmotic pump. In this, it has no water chamber activation. It has no water chamber. So activation occurs after imbibition of water from surrounding environment. In this, uh, as shown in the diagram, this is a porous membrane support. This is a semi-permeable membrane. Here we have a solution, saturated solution of MgSO4 containing MgSO4 solids. As the water through the semi-permeable membrane enters in this part of the section, it creates a push, and this is a movable separator. It is known as a separator as it separates the drug chamber and this MgSO4 chamber. Water combines with the MgSO4, it produces pressure, it gives a push, and so the movable separator is pushed towards outside, that is the drug chamber, and so due to this push, the drug is released outside the orifice. Entire procedure is given. Next, we will talk about Higuchi Thews osmotic pump. As shown in the diagram, it's same. It is a semi-permeable membrane. There is a orifice. Osmogen is present. The wall is flexible, collapsible material. So, samely, the water will be absorbed through the semi-permeable membrane. It will create a pressure, and by creating a push, the drug will be released through the orifice. Next is elementary osmotic pump. It is fabricated as a tablet coated with semi-permeable membrane, usually cellulose acetate. A small orifice, it is produced in a tablet form. Okay. A small orifice is drilled on the tablet. We have to drill a small, minute hole on the tablet. It's drilled through the membrane coating. When tablet is exposed to aqueous environment, the osmotic pressure of the soluble drug will increase. As and when we take the drug enters our gastric fluids, the osmotic pressure will increase, and this osmotic pressure will help to release the drug through this orifice. This membrane is non-extensible and increase in volume due to imbibition. The membrane made is non-extensible and it only increases in volume due to imbibition, and it raises the hydrostatic pressure inside the tablet. So the drug can be released outside through the orifice. Next, we will talk about the push-pull pump. As shown in the figure, it is used to deliver both poorly water-soluble and highly water-soluble drugs at the constant rate. One layer contains drug in formulation of polymeric osmotic agent and other tablet excipients. These suspension of drug is formed in situ formation. Water is pulled in the compartment. As we can see, it is a polymeric push compartment. It is an osmotic drug pool. Same water will be pulled in the compartment. It forms a solution of suspension of drug. This compartment will expand, and so as it expands, a push will be given to the upper compartment, so the drug is released from the orifice. Next is the controlled porosity osmotic pump. Same. In this, it is an osmotic tablet where the delivery orifices are formed in situ through the leaching of water-soluble pore-forming agent. A water-soluble pore-forming agent is used outside the tablet. When it enters inside our body with the help of the fluids in contact, it creates minute microporous membrane, and through these minute micropores, the drug is released outside the dosage form. Next is liquid oral osmotic system, that is known as LOROS system. Provides controlled delivery of liquid drug formulation, induces LORS hard cap, LORS soft cap, and delayed liquid bolus delivery system. Each system includes it is same system that is for used in the form of a, or it is present in the form of a capsule, and it works on the it is used mainly for the liquid drugs that have to be given or that have to be delivered inside the body, and it works on the same osmotic principle as we have seen above. Last is sandwiched osmotic tablet, that is SOT. It is composed of polymeric push layer sandwiched between the two drug layers with two delivery orifices. We have middle is the drug layer. We have two semi-permeable membranes. Sorry, two drug layers, and middle is the push layer. The middle layer pushes on the both sides, and the drug is released through both the orifices present on different sides. Thank you.